Hey guys, today I'm gonna be talking about hypersensitivity reaction, and I'm gonna be talking about what is the basic concept behind these four hypersensitivity reaction. Now, as we all know, there are four different types of hypersensitivity reaction, which are type 1, type 2, type 3, and type 4. So the basic thing that you need to know is type 1 hypersensitivity reaction is antigen mediated hypersensitivity reaction. Type 2 is antibody mediated. Type 3 is immune complex mediated, and type 4 is cell mediated, and these cells are basically T cells. Now if you understand this, if you remember this and understand this is gonna help you solve almost all of the questions that come on hypersensitivity reaction in any exams. So what does it mean? What is antigen mediated, what is antibody mediated? We'll discuss this in detail. So first we'll discuss type 1 hypersensitivity reaction. So what happens in this is there's a foreign antigen, and foreign antigen first pre-sensitizes the body, and once the body is sensitized to the antigen, on re-exposure of the antigen, it binds to 2 IgE. Look, these both are IgE on a mast cell. So whenever there's a foreign antigen, this could be anything, but in most cases, like for example, let's take asthma. So this foreign antigen might be a pollen. So this binds to 2 IgEs on the mast cell, and this causes the release of histamine, and then histamine causes all its effects. Type 1 hypersensitivity, the examples are asthma and various atopies. Now moving on to type 2 hypersensitivity reaction, which I told is antibody mediated. I'm sorry for the drawing guys here, but if you can understand this drawing, this is this is a normal cell of a body. Let's take it any random cell, and these cells basically here they have like antibodies on them, and the antibodies are attacking the normal cell. That is type 2 hypersensitivity. That in a nutshell is type 2 hypersensitivity, that antibodies of your body go and attach themselves to receptors on normal cells. This could be RBCs. So the example could be hemolytic anemia, where RBCs are lysed by the antibodies going and attaching them, or it could be the renal cell. The example of it could be Goodpasture syndrome. So that is type 2 hypersensitivity. Let's go to type 3 hypersensitivity. Now in type 3, this is a normal layer of the body, this whole black thing, and this what I've drawn here are immune complexes. Okay, immune complexes. So there's basically immune complexes. Suppose there's an exposure to any antigen, and then there's formation of antibodies to that antigen, and then antigen antibody, these complexes, they aggregate in a place, and that place could be the renal glomerulus or any other place. And when they aggregate, these aggregated immune complexes, they draw in complement, and what complement does, it brings neutrophils, and once neutrophils come into the picture, neutrophils release lysosomal enzymes, and these enzymes, they digest and attack the normal cells. So that leads to damage of the normal cells. A classic example of this is post-streptococcal glomerulonephritis, and other Examples are Arthur's reaction, serum sickness, and now going to lastly type 4 hypersensitivity reaction. The classic example of type 4 hypersensitivity is contact dermatitis. What happens in contact dermatitis is, suppose you are exposed to a particular any chemical on your hand. So this is your hand, hand. This is a chemical, and now that chemical is going to be absorbed in your skin, and that is going to be processed, taken up slowly into the lymph nodes. And in the lymph nodes, these T cells, which are naive T cells, undergo they basically see this antigen, and they train themselves, training of T cells, and to CD8 and CD4 cells. CD8 cells cause direct cytotoxicity to the skin, and CD4 cells recruit further immune cells and cause inflammation of the place upon after 1 to 2 weeks. That's why type 4 hypersensitivity reaction is called as delayed.